live earlier today, only to realize about, who knows, however many minutes in, it stopped recording. So here I am again. I'm going to try to talk about a little bit of what I talked about earlier. But essentially, I wanted to talk about Black women and colorectal cancer because March is Colorectal Cancer Awareness Month. And there's a variety of things that put Black women at higher risk of developing colorectal cancer, lower likelihood of getting screened and getting treated. And I just wanted us to be informed because an informed person is an empowered person. And I just want all my girls, my 92%, to get ourselves screened. Okay? If you are age 45 and you are average risk, so you don't have an elevated risk of colorectal cancer in your family, it is time for you to get screened. And what does that mean? Screening means, there's essentially three-ish ways, and one of those ways is the best way. So the three ways that you can get screened for colorectal cancer is in order from least recommended to most recommended. Number one, the FIT test. The test essentially just detects if there's blood in your stool that you can't see. So if you've got something in your GI tract that's bleeding, but it's not bleeding briskly enough for you to see it, like in the toilet or when you wipe, and it's getting just kind of like stuck in the stool, this test can detect that. That said, there are a lot of false positives for this FIT test, and if it is positive, you're going to need to get a colonoscopy anyway. So it's not ideal, but better than nothing. The second test is one of these cancer DNA tests. So the one that most people know about is like the Cologuard test. Essentially, it is an assay that detects cancer DNA. And what you do is they send you a box, or you purchase the box, you go home and you poop, you get a sample of that poop, and you put it in their container, and you mail it back to them. And they test it, and they look for cancer DNA. Now, the upside to this is you don't have to prep, you don't have to go to, you don't have to skip work. There's a lot of things that, the discomforts of why people get a colonoscopy are eliminated with this. That said, if this comes back positive, you're going to have to get a colonoscopy anyway. And there is a false negative rate, so there's a chance that things could potentially be missed. And there's a false positive rate, so that means that it could be positive, but and then that causes some stress, and you get a colonoscopy and it's negative, hopefully. But what I would say is regarding this Cologuard test is that it only detects once there is cancer or like an advanced precancerous polyp. So it detects when the cancer is already there. Now, colonoscopy, that's really kind of the one that we recommend, right, for colorectal cancer screening. The reason for that is colonoscopy is not only screening, it is diagnostic, meaning that if you've got symptoms, it can diagnose what's going on. It is preventive, and it can be treatment. So what does that mean? Screening means we're going to go in there and we're going to look to see if we find anything. Diagnostic means if we do find something, we can either biopsy it or get a piece of it or take it out so that we can figure out exactly what it is inside of there. That's diagnostic. Preventive is because a lot of colon cancers will start in a polyp. Not all polyps are precancerous, but if it happens to be a precancerous polyp, which we can't tell just by looking at it oftentimes, you can remove it and send it to pathology. If you remove it entirely and it happens to be a higher risk polyp, you've gotten it before it's become a cancer. So you have prevented cancer in that person. And then treatment. So let's say there is a big polyp, you remove it, and you even remove some healthy tissue around there, and there's like a little tiny dot of cancer in there. That may be all you need to get rid of that cancer. So it could have been the treatment for cancer. So none of those other tests can do that, right? So that's what I mean when I say get screened for colorectal cancer. What I truly mean deep down in my heart is get a colonoscopy. What it really means is make sure you do one of these tests to make sure you don't have it. Okay, so back to Black women and colorectal cancer. So, not only is the incidence higher in black folks, black women tend to be diagnosed with earlier, like younger, with more advanced stages. Okay. Um, the other thing is there is a delay, like a 4 to 6 month delay in black women from when they have their symptoms to when they actually get their diagnosis. And that's for a multitude of reasons. Number one, taking care of the household, taking care of kids. We have jobs where we can't take time off of work to get to take care of ourselves. Always kind of putting others ahead of ourselves, right? So taking care of other loved ones, things like that. And so there's a delay in just getting a diagnosis. The other thing is implicit bias in healthcare, right? So the data shows that black patients, particularly black women, tend to have worse outcomes when they are treated by a physician whose demographics are discordant from their own. What does that mean? That means if I'm a black woman and I'm getting treated by a man or getting treated by a white man or getting treated by, any demographic that is not that of my own, there's a risk of something called stereotype threat and implicit bias. What is stereotype threat? Stereotype threat is when, let's say, a population of people is stereotyped to be, dumber or slower, or, that they don't take care of themselves, or that they eat poorly, or things like that. If I, as a black woman, go in to see a white physician or a white male physician, for example, in the back of my mind, I'm wondering, is he stereotyping me with all these stereotypes that don't apply to me? But is he stereotyping me? And what happens with stereotype threat is, because of just the threat of the stereotype itself, we tend to have this self-fulfilling prophecy where we fulfill that stereotype in that instant, right? And so that then just puts back in their mind, okay, well, she's not eating right, or she probably only wants to eat, she probably wants to eat, only fried food, or whatever it is, right? Whatever the stereotype is, you end up sort of fulfilling that in their in their brains, right? And then that turns into worse outcomes, right? Okay. Next. Yeah. So that's worse outcomes for black women when we are not treated by other black women. The other thing is we tend to get diagnosed with more aggressive forms of cancer. And a lot of these, so let's talk about sporadic versus genetic, right? So black women are more likely to get diagnosed with colorectal cancer, right? That said, the majority of colorectal cancers are what we call sporadic, meaning that there's nothing in your genes that's putting you at higher risk of getting colorectal cancer, right? So that's what sporadic means. A genetic or hereditary colorectal cancer means that you have some genes that predispose you, that make you higher risk of getting colorectal cancer. So the majority, all across the board, no matter your demographic, you're at higher, if you're going to have a colorectal cancer, it's more likely that it's going to be sporadic, not genetic. That said, even with the rarer type genetic colorectal cancers, even with colorectal cancers, there is a higher incidence of something, let's say, called Lynch syndrome, which is a hereditary cancer syndrome, including colorectal cancer, including uterine cancer, lots of other types of cancers, right? GI cancers. And so black people are at higher risk of having this genetic mutation as well. So there are a multitude of reasons why the incidence of colorectal cancer is higher in black folks, and why there are some barriers to black women getting treatment and getting effective treatment. So all this to say, if you're a black lady, if you're anybody, but I'm talking to my black women friends and sisters right now, go get screened, please. I recommend you go get a colonoscopy. You're asleep for the whole thing. Okay, that's another thing, is that you're going to wake up, you're going to feel it more than likely, especially if you have an anesthesiologist or CRNA. You are going to be asleep, and it sometimes is the best nap that you're ever going to have. Okay, It's going to hurt. You don't feel anything when you're asleep. I've, in fact, I've never really had anybody tell me that they feel anything. Sometimes afterwards you get a little bit of bloating, maybe a little bit of cramping from the residual prep, but by and large you feel pretty much back to normal within a few hours of your colonoscopy, if not by the next day. So pain is not really, it's not really a thing with colonoscopies. I mean, unless you do it awake, it can be uncomfortable, but even then I've not really had people complain of pain. And yes, I've had people that have done this awake. Um, what else? The prep. I mean, yeah, it's not the most pleasant thing either, but ask about different types of prep that you can do. There's not only just one type of prep. It's not just only the big gallon of Go Lightly. There's multiple different types of preps. The one that I use specifically happens to be 2 over-the-counter medications. None of them have any kind of flavor. It just tastes like the Gatorade that you put it in, and it's half the volume, and people get really great preps out of it. So if you don't want that big gallon, then ask away. Ask what your other options are. What else? What are our other reasons? Oh, we don't want to know. That's another reason why people don't get a colonoscopy. You don't want to know what's in there. But I'm here to tell you this. Whether or not you know doesn't mean that it's not going to be there. Okay? It doesn't mean that it's not going to be there, and it doesn't mean that it's not going to have its way with you. And I'm not saying this to scare anybody, but I've seen this, I don't want to know what's going to happen. The thing with colorectal cancer is it is one of the more treatable cancers. So if you do go get your screening and you happen to have a colorectal cancer and you're asymptomatic, that sometimes may mean it's on the earlier side and you can be treated for it. Okay. So knowledge is power. Okay. Make sure you get screened, make sure you know what's in there, make sure you know what your risk is. And get your scope. Okay. Get yourself, next time you go on your girls trip, then you all can have your clean bill of health. Okay. So yeah, if there are, I don't know who this person is that's commenting, but if you have any questions about colorectal disorders, specifically colorectal cancer, please feel free to subscribe to the channel. You can always, if you're in Houston, you can come to my office. We can have a conversation. We can talk about screening. You can follow me on other social media platforms. If you are not in Houston, and let's say you've been suffering with some sort of colorectal issue for a long period of time, you feel like you're not getting the right answers, you feel like you're not being heard, you feel like you can't advocate for yourself, you've done a million different tests and you're not getting the right answers, no medication, nothing's working, or you just have a question about, what it is, what it is that's going on with you. I also have a consulting service that I do for people that are not in the state of Texas. I'm licensed to treat you as a physician in the state of Texas. Outside of the state of Texas, I have an educational program where we can do a one-on-one conversation. It's essentially like a second opinion where I can review your case. I can go over all the details of it. I can educate you as to what has happened. It's not medical advice, but it's education. So I'm going to empower you with education, what all these things mean. I'm going to talk to you about different providers or physicians that are in your area that I can connect you with, so that you can get the help that you need. The other thing that I'm going to do is I'm going to empower you with phrases, questions that you can ask people, ask your provider, ask your doctor if you feel like you're being ignored. If you feel like you're being ignored, okay? Or if you feel like you're getting answers that just don't make sense, I'm going to provide you with ways that you can interact with healthcare providers so that you either get the answers that you need, or they can get you somewhere else, somebody else that can't answer your question. Okay, so that's called Second Scope Consultants, www.second, it's a 2ndscope.com. Or you can check out my website, HoustonCommunitySurgical.com. Again, if you're in Houston, come see me. I'm in the Heights. If you're not and you need some help figuring out what's going on, please go ahead and go to secondscope.com, 2ndscope.com, and we'll get you set up with a time to do a consultation for some education. All right. Otherwise, get screened. My black female friends and sisters, please go get screened, get a colonoscopy, find somebody near you that can do this for you. It's a one-day situation. Okay? All right. Y'all be safe out there.